on Undistracted, it is an absolute pleasure to have clinical psychologist Melissa Levi joining us. Thank you so much for your time today.
No, thank you for inviting me. I'm delighted to be here.
And I wanted to talk to you especially around the subject of your book. We need to talk about aging because that's something that we can be a little bit avoidant with, I think, in society, but also not just how we age in terms of getting older physically, but what it means to enter that kind of later stage of life. When you wrote the book, it really is framed so much around your experience with your granddad, your Zaida, if I'm saying that right. Tell us a little bit about him and the role that he played in your family.
Oh my goodness. So I consider myself so lucky because I really had a grandfather who was, I guess, everything that you sort of hope and dream your grandfather would be. Just this sort of, oracle of wisdom and just non-judgment and boundless love. It's a relationship that I think is just so different to any other that you have in your life. It is just this unconditional place of acceptance, and I suppose that's something that my Zeta sort of brought to me personally, but also to our family, is that really he was also a mentor. So
Mm.
he was the person that we would go to seek life advice, and to sort of learn about the world. And yeah, he loved nothing more than to educate and to teach. He thought it was the greatest gift to impart sort of knowledge, to another person.
Because there is an inevitability to age. If we're afforded the luxury of a long life, we are going to age, we're going to get older. But the thing that is distinct between one experience to the next is really how well we live, something that you distinguish as not just our lifespan, but our health span. Is that where we need to be putting more of the focus on in this conversation around aging, perhaps what our health span is going to be like? Is that what's missing from the current understanding of aging?
We tend to confuse the inevitability of aging, and also when we say almost inevitability, it's almost like this sort of this burden or this struggle that's coming
Mm.
our way, when actually I found that if we plan well, and we'll talk about this, invest in our health, and actually it can be a real blessing. As one of my clients said to me, she said, darling, think of the alternative. So aging is a blessing, but I think we tend to confuse the inevitability of aging with an inability to shape the journey ahead. And
Mm.
we actually have so much power, more than we realize, to not always shape, the twists and turns that might come our way. They can sometimes be out of our control, despite our best efforts and our best intentions. But we can absolutely take control of how we prepare for and respond to those challenges. And
Mm.
it's those plans, it's having the right people in place, having that is what opens options. It's what gives us choice. It's what gives us autonomy and allows us to sort of, remain in the driver's seat of our own lives.
Mm. And I'm glad you did actually sort of pull me up on the word inevitability, because it is something that can be so sort of attached to fear. Like when we say something is just, it's coming and there's nothing you can do about it. I think that does have a connection to a fear mentality. And that's sort of the language, the idea that we do bring to aging in our Western culture, unfortunately. And yet, as you say, aging can be this blessing. So what is it that we need to change our mindset there? How does aging go from being something that we fear because it is going to happen and we can't do much about it, to something that we see as a blessing?
So I think a huge part of the transformation for me personally, and then maybe I'll sort of extrapolate from this more broadly, is, when I was doing my master's of clinical psychology, I knew exactly what I wanted to do. I wanted to work with kids. So we had to do these professional placements where you would spend 6 months sort of, in a real world service. And so I put down, all of the best child and adolescent services. And one day I bumped into my clinic director at uni and said, oh, how are you? She said, gosh, I'm finding it really tough securing everybody's placement preferences for next year. And I said, well, don't worry about me because I'm happy with anything. Long and the short of it, I get told that I am working in an older people's mental health service. So I did, I think, what any other young professional would do in the circumstances. I called my mum and cried. And what I realized, though, was that I wasn't crying over the disappointment of missing out on my preferred child and adolescent sort of placements. I was crying because I was afraid.
Mm.
I was afraid of coming face to face with what I assumed aging meant, that it assumed loss, that it assumed illness and disability, a lack of autonomy, the absence of any sort of joy in life,
Mm.
and that it would be depressing and that I would be seeing people dying. And, I was sort of terrified of all of that. But very, very quickly in that placement, I got a completely different perspective of what aging could be.
Yeah.
And I guess this is why now I see it as a blessing, because what I've learned is, I tend to think of aging according to three sort of trajectories. I guess the first one is sort of what we might think of as like normal aging. So this is where, yes, we experience some changes in our health. So maybe, a bit of arthritis, or some challenges where our memory's not as laser sharp as it once was. We used to, never forget an appointment or go to the shops and never need a shopping list. And now we need to sort of keep a calendar, keep a diary.
Mm.
Um, but we're still able to sort of live life on our own terms and do the things that matter to us. So that's how I sort of think of normal aging. And I had a patient who, she lost her husband some years before. She was still living in her own home. And she said, look, the knee plays up from time to time. She had some difficulties with her blood pressure. So she said, I'm not as efficient in cleaning the house.
Mm.
So if I'm not feeling good on a particular day, I leave it. There's no one here to complain.
Yeah.
And, I used to walk to the local shops to meet a girlfriend. Now I catch the bus, or there was a community shuttle that she used to
Mm.
use quite often. So she had to make modifications, absolutely, but she was still able to do the things and be with the people that mattered to her. So that's
Mm.
how I sort of see normal aging. And then I sort of think of another trajectory that is successful aging. So this is like your Queen Elizabeth, still rocking a lime green twin
Yeah.
set at like 90 something, longest reigning monarch. This is,
Mm.
Nelson Mandela became president, in his 70s. But even in my own family, I think of my husband's grandmother, who I've sort of adopted as my own. She was legally blind for most of her life and had an eye operation in her 70s that finally gave her, improved
Wow.
vision.
Mm.
She's now 94, and in that time, she has published 3 books.
Wow.
She took up line dancing. She, so again, for me, that's successful aging. So that's someone who experiences sort of little or almost no change in their health.
Mm.
And is still able to sort of do everything that they wish. And I guess the exciting thing there is that while we used to think of successful aging as being sort of, the fortunate few, or the
Yeah.
actually, there are a lot of doctors and scientists that are now arguing that actually that could really be the norm,
Mm.
and that is what we should sort of aspire to as we get older. And we can maybe talk about some strategies for that.
Yeah.
But the third trajectory, just briefly, is what I think of as sort of compromised aging. So this is where often we receive a diagnosis of a medical condition that has compromised the natural aging process. So this is something like dementia, something like Parkinson's disease, something like sort of heart failure. But what I really want to emphasize here is that, yes, absolutely, it takes an enormous toll on, someone's ability to sort of, function independently in their daily life. But I've also seen firsthand that with the right level of support and modifications, and this is why these conversations are so important, because
Mm.
if we know our options early, we might be able to slow the progression of the disease medically, but also we can access support services and care services, have our ducks in a row, so that, yes, it may not be exactly as we wish this time of our life would be, but we can still do things that bring us meaning and joy and purpose. We can
Mm.
still live with
It's
intention.
No, it's really well put because I think that's one of the things that you actually pull out in the book. There's a quote here that I wanted to share where you say that good health in and of itself is not the distinction between aging and getting old. It's in fact our ability to continue to live a life of meaning, as you put it, a life consistent with our values that most profoundly determines one's journey through aging. So it's not that we may get sick or we might not get sick or we might have to, catch the shuttle instead of walking. It's that can we still, whatever our aging journey looks like, be living consistent to our values. So if we want to get to a place in later life or whatever stage we might find ourselves in now, how do we start to set ourselves up, look after ourselves in a way that will get us to that point of our aging journey looking like one that can remain consistent to our values, whatever our health status might be?
I love that question because I think this is so powerful. It's like, what can I do now? So I guess I might even speak to maybe people at different stages of life.
Sure.
So if I sort of start with maybe people who themselves are in their, 50s, 60s, 70s, and maybe they're looking ahead and thinking, okay, what can I put in place for the future? I think the most important thing is to start having conversations with family and your doctors about your wishes and learn about your options. So, one of the most difficult parts of getting older, as you say, is this sort of sense of fear, but it's often fear that comes from just the unknown.
Mm,
And often, once we better understand our options, okay, I want to remain in my own home. That is my wish. As much as possible, I want to stay in my own home. Okay, have a conversation with your family about that. What are your loved ones or your friends or your neighbors, willing and able to do to support you in that? Have a chat to your GP or even to your local community center or My Age Care about, maybe what government funded care are you entitled to that can help you remain in your home, and, pop yourselves down on some wait lists. You can, if your name rolls around, you don't have to take it up right away. You can just sort of stay there. And it's one of those, umbrella in the back of your car. It's
yeah.
nice to have it, before it starts pouring. Um, so I think it's really the conversations that we have with the people we love, with our doctors, and we can talk a bit about how to have those conversations. And it's also the conversations that you have with yourself. One of the questions that you can ask yourself that is often quite powerful is, what does a good day look like to me?
Mm,
Because what you'll find in that is, what is it that brings your life a sense of purpose? What is it that brings your life a sense of meaning? What is it that can bring you a sense of joy? And how can you continue to tap into those things as you're getting older? So I think the first thing is having those conversations. And usually the themes are health. So, what are your wishes for your health?
mm,
For example, if you were to receive a very difficult diagnosis, um, would you want to sort of pursue treatment, as invasive as it may be, for the desire of, prolonging life as much as, possible? Or would you rather sort of have some discussions around, at what point would you rather look at some comfort measures and what
mm.
services like palliative care services are available to you? And so just understanding a little bit about that. I think the second one is around care. Where would you like to live? Who would you ideally like to be caring for you? The third one is often around sort of your end of life. How you would like to die, and you can again, speak to your doctor around all the options for that, and also, following your death, what are your wishes for your estate,
Mm,
and how you want that to be managed? And as much as these conversations can seem quite daunting, in my book, We Need to Talk About Aging, I've put in some conversation scripts, like some language that you can use to open these conversations up, some checklists of questions and agenda items to help guide this discussion so that
mm.
it doesn't have to feel foreign. You're not doing this on your own. And often these conversations feel hard because they are hard. We're
Yeah.
doing something that is so outside of our comfort zone.
Mm.
But in my experience, with the right sort of support, most people that have these conversations and their families are so grateful that they have. And they described them. One son said to me, he was quite emotional because his dad was nearing the end of his life. And actually, his dad said to me, in the last few weeks of his life, he had terribly progressed Parkinson's disease.
Mm.
Um, and he said to me, because we had had so many conversations about his wishes and there was a really elaborate sort of plan in place for him, he said, I would never have thought that I'd say this, but I think the last few weeks have been some of the best weeks of my life.
Wow.
And
Mm.
his son said to me very tearily, he said, those conversations, which his son was quite resistant to, it took a lot of encouragement to get him to come and sit at the table with us.
Mm.
He said they were such a gift because I knew what to expect. I knew what dad wanted.
Yeah.
So when I had to make tough decisions, do we transfer dad to hospital? Do we, look at this medication treatment? He's like, I just had this compass, this guiding compass where I could make these hard decisions without a sense of heaviness. I had
Mm.
clarity. And then he said to me a long time later that it also afforded him a lot of resilience in his grief because
Yeah.
he was comforted that they'd done the right thing and he didn't second guess
Yeah.
anything.
Yeah. And that's a massive gift to be able to give
Yes.
families that sense of peace and an anchor, a compass, as you put it, through one of these challenging times. Like your mind can be so all over the place as you're just grappling with the reality of death itself and all of the things that conversation can bring up. But to say, hey, I have a pathway through it, such a gift.
It is such a gift. And I think now to turn it, so that's sort of like when we're looking at sort of preparing for embarking on our own aging journeys. But if you're a little bit younger, if you're sort of, say, maybe you're in your 20s, 30s, 40s, 50s, and maybe you're looking at sort of, gosh, what can I do to help mum and dad to sort of age successfully, in
Mm.
inverted commas, or what can I do for myself?
Yeah,
So
make sure our own
there
health is in line.
Yes, and this is where it gets super exciting. So there was a study published initially in 2017. It was revised in 2020 in The Lancet, which is a very prestigious medical journal. And basically, this study indicated that 40% of all dementia cases are due to modifiable risk factors.
Mm.
So they're potentially preventable. And they came up with all of these lifestyle recommendations that have been shown to not only be good in preventing dementia, but they're also strategies for generally aging well, aging with better health, with sort of, greater psychological well-being,
Yeah.
and also not just strategies for aging well. I think of them as strategies for living well, so some of these things, and I'll just summarize a few of them. The first is whatever is good for your heart is good for your brain.
Mm.
So we've heard it before, but certainly sort of looking at a Mediterranean style diet, um, exercise so that, we're keeping our cardiovascular system really fit. And also, there was some research in the blue zones, which are areas of the world that have some of the most sort of longest lived and healthiest people. They have the highest number of centenarians, so people over 100. And the nice thing there was that when they looked at exercise, it wasn't running a marathon. It
Mm.
wasn't, pumping iron at the gym. It was just sort of that constant movement of housework and gardening and being part of a community. And
Mm.
so it doesn't have to be onerous. It
Yeah.
really doesn't. Another big one is having a sense of meaning or purpose. And this is sort of that in Japan, they call it ikigai, which is sort of, what's your reason for getting out of bed in the morning? Um, and it makes me think of that quote that was, I think, attributed to Viktor Frankl, where he says, you know, um, a man who knows his why can bear with almost any how.
Mm.
And I think, it's whatever twists and turns come on our journey through life, if we have a strong sense of purpose and meaning, whether it is your family, whether it's your faith, whether it's volunteering and contributing, whatever it might be, um, that is an enormously protective factor as you age and as you live.
Mm.
Another one is learning something new. So a lot of people, a lot of my friends say, I'm doing Sudoku or I'm doing, crosswords because I'm protecting my brain.
Yeah.
And I'll say to them, that's fantastic. All of that is great. but they'll say, but I'm so good at them now, I can do them in a minute flat. And it's sort of like, what you want to do is you want to learn something that the current sort of neural networks in your brain can't accommodate.
Mm.
So it can be learning a language, it's an opportunity to do those things that we often sort of, romanticize but never do,
Yeah, yeah. And things that
learning, cooking. Yeah.
right, things that make sure our brain doesn't stagnate essentially.
Correct, correct. So anything that's new, an instrument, travel, anything that's new, is a really good investment. And the other one that I'll mention here that I love, is around our relationships. So you might have heard of this something called the study, Harvard study of adult development. So it is the longest running study of adult life, I think, in the world now. It's been going for over 80 years.
Wow.
And basically, in the 1930s, researchers looked at a group of Harvard graduates and then a group of men from some of Boston's most disadvantaged suburbs. And they have followed them up every 2 years and looked at their medical records, blood tests, brain scans, spoken to their families, looked at their professional achievements, their financial status, everything to sort of get a picture of their lives. And they asked the question, what is it that constitutes a healthy, happy, long life?
Hmm.
And there was one factor that separated those that had a healthy, happy, long life and those that didn't. And it wasn't IQ, and it wasn't wealth, and it wasn't professional attainment. It was the quality of their close relationships.
Hmm.
And I just think it's so important because I think in this modern world, we do often tend to take our relationships, especially those that are close to us, maybe a little bit for granted. And
Yeah.
maybe they fall behind other priorities. But I think if we can invest in our relationships very intentionally, very deliberately, it's an investment in our health and in
Yeah.
our health span and our lifespan.
Yeah, yeah, it's a good thing on both regards or both sides. And I so love one of the reasons that I really wanted to talk to you was because there's such a excuse me, there's such a hopefulness that you bring to this discussion of aging. You see joy in it, you see possibility in it. You reference being able to have something that brings us a sense of why. And there's even a point where you talk about a sense of meaning that blossoms with age. Why is that our feeling of meaning, our feeling of purpose can actually expand as opposed to diminish?
Oh, it's such a good question. And it's something counterintuitive. It's something, unexpected. I think for a couple of reasons. I think Arthur Brooks wrote a book called From Strength to Strength. Um, and I'm sure I won't do it justice, but basically in that book, what he says is that in the first sort of curve of our life, in the first sort of half, maybe until we're in our 40s or 50s, that's when we're really achievement oriented. We are striving. We're always wanting for something more. We're sort of chasing this idea of success, which is often sort of, money, power, influence,
Mm.
fame. Um, and he said those that then have what he calls sort of this renaissance in the second half of their life, or have this great sense of meaning and joy, are the people who successfully jump from, okay, that period of that sort of really success driven, very sort of person centered driven, it's about myself and
Yeah.
my ambitions, then jump into what he sort of calls like wisdom and mentorship.
Mm.
So you sort of shift. And I think what you realize is you have enough lived experience by that stage, I think, firstly, to cut out some of the noise, and you have a really clear sort of sense of what actually matters, what doesn't, what's fleeting, what's permanent. And if you're then able to get yourself into a position where you're able to share that perspective and share that wisdom and essentially mentor others, that can be one of the most richly fulfilling times of our lives. And
Mm.
in hindsight, I think our conversation in some ways has come full circle. That is exactly what my Zeta did. Um, and he had dementia, as you know, but it really took hold in his sort of late 80s. And I firmly believe that the reason that he was able to function so well for so long was because when all of the other things that gave him meaning previously in his life, so he was, very much into sports and athleticism, when his body could no longer sort of, sustain that, and when, he ran his own business his whole life, when that became a bit too challenging, he wasn't left lacking his why or his meaning.
Mm.
His meaning was to mentor and to serve others. And I think in some ways there's a fulfillment that comes with that that doesn't come from the ways that we tend to chase fulfillment early
Yeah.
in life.
Yeah, and I think there's also too, I can imagine, I mean, for any of us, when someone listens to you, when someone respects your ideas and leans into what you have to say, there is a sense of elation that comes from that validation. So for people who are in a later stage of life who have someone who listens to what they have to say, whether they accept the advice or not, but simply that they listen, I think that probably stirs a an excitement for life as well. And there's a quote that you pull from an author named Mitch Albom that I think touches on this a little bit, where he says that I am every age that I have ever been. Like once you get older, you're not just 80. You can also be 60. You can think of your 20-year-old self. You can go to your 30-year-old self, and it's like within you as you age exists every single person you've ever been. And I think there's that, to me, I was just like, that is such a beautiful picture of how much wisdom, as we've said, is in the elderly among us. And I think that that kind of brings about a sense of respect, that we should have for them.
Absolutely, and I think there's two things that come to mind. I For most of my working life, I was at St Vincent's Hospital in Sydney. So for those that are familiar with the area, you're probably sort of nodding, and for those that aren't, it is just a really richly diverse area. So because of our sort of geographical catchment, we would see. Some immense wealth and affluence. We would see some really sort of, awful poverty and hardship and homelessness and trauma. And there was just this enormous, enormous spectrum. But there was something that I observed, when you sit with a lot of people as they are nearing the end of their lives, irrespective of their background, their culture, every single person wants to know that they matter.
Mm.
They want to feel seen. They want to feel heard. That doesn't change as we age. Age doesn't negate that need. It doesn't negate the need for for autonomy and the right to be seen as an individual, as you say. We look at ourselves now in our 30s, 40s, 50s. You might feel that exact same way, and it's just the
Yeah.
packaging on the outside that changes.
Mm.
I had a fashion designer. She was 101, and she needed the help of her carers to get her, showered and dressed. And despite having a tremor, she still had reams of paper where she would be sketching designs and outfits that would come to her mind. And she she said to me one time, she goes, "What does it mean to be an old lady?" And like all these like 20 bangles on her arm are like clanging as she's,
Mm.
doing these inverted commas. Like for her, the outside had changed, sure, but she was just as vibrant and alive and ambitious and
Mm.
passionate as she was in her 50s,
Yeah.
And I really think that is something that I hope people get from this, is that if we think of what we want for ourselves when we're older, I'm in my 30s, mid 30s now. So if I think of myself as an older woman, I mean, firstly, I'm excited to experience that stage of life. I'm actually not at all afraid of it because I've seen how wonderful it can be.
Mm.
Even when there's hardship, I can see how we can make it better. But I think all I will want to know is that I still matter to the people that matter to me.
Mm.
So I think if you have an older person in your life, maybe take this as that moment to pick up the phone, drop in for a cup of tea. There's the greatest gift you can give them is your
Yeah.
connection and your time.
Mm. And there's one question I want to finish with, Melissa, which I normally will ask people on this podcast because it's called Undistracted. We talk about living life in line with your passions, your purpose, dealing with what gets in the way of that. I feel like in your line of work, the wisdom that your clients, your patients have kind of brought into your life is something I think we want to feed into the younger generation especially. So if there's people listening right now who do want to live that intentional life, who want to be in line with the things that they feel like they should be giving their time and attention to, what have you learned from the people that you've worked with who are at that later stage of life that you would pass on to that person trying to embrace a more intentional life now?
And it's you've really hit the nail on the head. If I think of how my own values and priorities and perspective on life has shifted over the past sort of decade plus, it's been a radical shift. And the I guess the sort of poetry of that is not lost on me, that in striving to sort of change my patients' lives for the better, I think in fact they've changed mine even more profoundly, and I really mean that. I'm certainly, I think, a different person than I would have been had I chosen another road in life. I think what I would pass on for them, if they could sort of, have this moment, so I'll be just a vessel for them. This is not sort of from me. And what they would say, the first, I know who would say this as well, is that your time is your most valuable, non-renewable resource. So spend it wisely. And I think intrinsic in that is also that give your time to the things that matter. And I guess that's the second bit of advice. And I've heard this from almost everyone, is that if ever you're confused about what matters, it's the people. It is the people that make a life. I think everything else it's superficial. It's noise. It's not to encourage you not to chase those things. I think by all means do. Be ambitious and enjoy the nice things in life. Nobody's telling you not to, but I think do it from a place of knowing your values deep down within yourself and bring those values to everything that you do. So I know my Zaida would say, his comment was always, is that one of the greatest sort of assets you have in your life is your name, your reputation. So protect it and show up in the world as the person that you want to be, with the values that you embody. um, and I think that would be it, just to spend time with people that matter. And yeah, be really clear on who you are, and also that's something that will unfold over time.
Yeah. Well, I'm so grateful we've got to speak to you a bit for a little while today, Melissa. There is so much more in your book, We Need to Talk About Aging, that I encourage people to check out, because by no means have we covered it all today. But Melissa, thank you so much for your time. I really appreciate it.
Thank you so much. Thank you for having me. This has been, a joy.
Hey guys, thank you for watching this interview. Make sure you subscribe to Hope 1032's YouTube channel so that you can stay up to date on all our latest content. But until then, watch any of these videos and enjoy.